Hey everybody, it's Matt Shu from Upright Health, and I did a video a while back. I don't even know how many years ago it was, but I did a video where I showed you how to use a foam roller to get at your pectineus and adductor brevis. And since that video has been up for so long, I went back and actually looked at some of the comments, and I saw that there were some people who are saying, like, I can't even get into that position. Is there any other way to do this? And in fact, there is another way to get into that area. And all you really need is a softball. You could probably use a foam roller, but a softball or any kind of one of these larger massage balls. I think there's the Orb, and I forgot the name of the one that is available through Rogue Fitness. But anyway, there are these larger balls. But if you just get a softball, it works out fine. You're gonna get a chair. Sometimes a dining room chair works. Piano benches work very well. If you're at the gym, a weight bench works generally pretty well, depending on how high it is. And all you need to do is put the ball on the bench, put your knee down on the floor or onto a pad. I tend to have very, how you say, I have a bony tibial platform, so I generally need to have something right here. Otherwise, I'm kind of poking a really annoying bone into the floor. Anyway, put the ball up onto the bench, you put your leg up over, and then you allow yourself to relax into that. So this area is what we're going for. It's very easy to control the amount of pressure. If you want more, then you lean more into that side. If you want less, then you put more weight over here. You can let your leg dangle over. That actually starts biasing in towards a little more adductor magnus. And if you kind of turn yourself this way, you can. I feel like you can get a little more of the adductor brevis and pectineus. So you're going all the way from up in the groin, all the way down towards the knee. You're going to have to reposition it as you go down towards the knee, or reposition as you go higher or lower. If you want to get all up into the groin, which I know you do, then you need to shift it and just bring it right there, and then let yourself relax as best you can into that, letting those tissues really kind of adapt to the situation. You're not trying to actively, press or thrust hard into this. You're trying to let those muscles ease into the position, ease into that pressure, so that it doesn't bother you so much. You can do the little things to play around, straighten the leg, bend the knee, all this stuff. But basically, you just want to breathe, relax, and let those muscles ease up. When you're doing any kind of tissue work, you're not looking to cause yourself undue pain. So you're not trying to push super, super hard. If it already hurts a little bit, that's fine. Just relax into it. You don't want to push into it to make it hurt even more. If you're on bone, you are probably not going to make much of an effect because that bone is not going to get softer. And if you're on something that's throbbing, you probably shouldn't be on it because you're probably blocking blood flow, so don't do that. But yeah, so if you've been looking for a different way to get to adductor brevis and pectineus, that's probably the easiest way you can do it without having to be super flexible with a foam roller. So I hope that helps you out, and I hope you remember that pain sucks, life shouldn't.